So this is computed tomography of the patient with disease, which we will try to diagnose a little bit later. And as the beginning, I want to stop on some basics of the computed tomography. First of all, projections. This is coronal projection. Also, we may use sagittal projection. I will show it to you right now. Sagittal projection, like lateral projection in case of the plane X-ray, yeah, and axial projection, So we must know the normal anatomy, topographic anatomy, in order to assess the position, size of the organ, the shape, in order to detect abnormality. So if we look at the frontal or coronal projection, we may see different structures. In order to visualize better different systems of the organs, we may use different windows for different system of the organs. In this case, we see the full dynamic window, and you can see that it lacks of the contrast between the structure. Soft tissue are more gray, the lung tissue darker, so it's not very comprehensive to assess. For instance, parenchymal organs, internal organs, it's a little bit difficult. That's why we may narrow the window of the Hounsfield units in order to assess, in order to better assess different system of the organ. What is Hounsfield units? This is a scale of the radio density. If we will point the region of interest, place region of interest over the air, we can see that it shows to us minus 1,000 of Hounsfield units, this first number. If we will put this region of interest over the bone, we see that the number will be much more higher, signalizing about the dense structure. Here we can see, this is the clavicle, the density of almost 1,000 of Hounsfield units. If we'll place over the soft tissues, over the fat, we can see that minus 100. Over the parenchymal organs like spleen, 38 Hounsfield units, over the liver, 43, and so. And if we place over the bone, marrow, bone medulla, it's 133. Over the heart, for instance, 43. Over the lungs, minus 874. So using this scale, this Hounsfield scale, we can compare the structure and perform differential diagnostics. And also we can narrow the window on this scale in order to assess a better different system of the organs. We can switch, for instance, abdominal window, and as you can see here, we can see better the parenchymal organ, their contrast to the fat. This is fat, it's dark, much more better compared to the other organs. So it's used, this window used for assessment of the soft tissue for the parenchymal internal organs. Next window, angiographic window, mainly used for the assessment of the vessels during the contrast injection. Bone window, if we will switch again abdominal window, we can see that the contrast between the bone, marrow, bone medulla, and the cortex, a little bit a little bit too sharp, and it's hard to visualize. In some cases, for instance, the metastatical invasions of the bones. Here, in case of ribs, we almost cannot see the medulla of the bone. If we will switch on the bone window, we visualize all parts of the bone, layers of the bone much more precisely, much better. So this window is perfect for the assessment of the bone abnormalities. Yes, again, you can see this lesion here, calcification, and if we will switch to this mode, it's almost undetectable. So now you understand the difference. Also, we get a brain mode for the assessment of the brain. And what is important, chest for assessment of the chest organs and for lung tissue. This is the mode which we will stop on. And now we will try to, first of all, assess the organs which we can see on the chest X-ray, the same on the chest CT. We can see different organs and we will try to name them. So first of all, this is the heart. Yes, I will switch through slices. So these are the slices through the heart. We can see the aorta here. This is the aorta. This is the aorta, aortic arc, and it goes down, 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 down to abdominal. This is already abdominal aorta. So this is descending aorta and abdominal aorta. Also, we can visualize vena cava. This is vena cava, seen here with the contrast enhancement, and we will look at the CT imaging during the next lecture on the abdominal CT using the contrast enhancement. We will see vessels much more better. This is the vena cava inferior. We can see the trachea here, the bronchi. We can see the lung hilum. These are the vessels. Yeah. We can see the ribs, the diaphragm. You remember the level of the diaphragm from the right side of the chest is approximately 2.5 centimeters upper compared to the left side. Diaphragm itself, yeah, cruise of the diaphragm, and bones, sternum. We can see the sternum, and we can see the vertebrae. So, and we can see perfectly the lung tissue, and we can see that something is abnormal here. The patchy consolidation here. If we will measure the place the ROI over the normal lung tissue, we can see the number is approximately minus 870 Hounsfield units. If we will place this region over this more brighter regions of the increased intensity of the signal, increased radio density, we see that the number is higher. It's 500 minus 520, signalizing that this is the abnormality. So I will look to another slices, and I can see that multiple regions peripherally and also medially can be seen almost in all segments of the lungs. So we can say that, this is the big region, and here, this is the almost 40% of the lung is invaded by the process. So this patient had a high temperature, had a PCR positive test. So this is the example, very characteristic for the COVID pneumonia. This is COVID pneumonia. The patient verified by the PCR test with the cough, with the anamnesis of the contact with the COVID patient. So remember this symptom of the mate glass. What is mate glass? It's a glass, not transparent, but a little bit, let's say, hazy. I will show you the example. And so this is the mate glass, yes, temperate. Same with this symptom, mate glass. It's very characteristic for the viral pneumonia. Now I want to just say a few words about the other organs from the anatomical point of view. These are the clavicles. If we talk about the internal organ, we can see only part of the abdomen, the liver, the spleen, the vessels, arteries supplying the spleen, the stomach, esophagus, stomach, gas inside the stomach, the intestines, the large intestine, the standing colon, transverse colon, and part of the upper pulse of the kidneys. Also can be seen the right kidney and the left kidney, pelvic calyceal system of the kidneys. So this is how we work with the CT images. We can switch between the different projections in order to perform three-dimensional reconstruction. We can also switch to different projections in one window and or in two windows or more windows, and we can using the marker detect on which level we are right now. So we can perform three-dimensional imaging like I'm doing right now. Yeah. So in all three projections, we can visualize the lesions. So please remember this picture, 74 years old, COVID pneumonia. COVID pneumonia. Also, you may create a three-dimensional reconstruction. As you can see here, the lungs cannot be seen right now. We can different modes. For instance, we can switch on to the airway mode here and look at this image in 3 dimensions. And we can see very good these patchy bright regions. This is the COVID invasion. So you can see bronchial tree very well and very precise. Also, we can cut through the image to delete the regions that we don't want to see. Also, we can switch to bones and airways mode plus skin mode. Another variant. By the way, this software can be downloaded for free. This is DICOM Radiant Viewer. It got trial period, so you can download it for free and download samples of the computed tomography image and try to explore it by yourself. Here you can see the bones, skin, yeah, and maximal intensity projection. Also, I can regulate the deepness of the reconstruction. Deeper reconstruction. In case when we use contrasting, we can see more vessels. We can also play different adjustments. So this is all for today. Next lecture, we will talk about the abdominal computed tomography. So see you on the practical seminars. Bye.